welcome to Let's Talk Jonesboro again. We're checking in with Dr. Shane Speights of NYIT. He's the Dean of the College of Medicine over there. And Doc, tell us what you're 2 years into being the everyday go-to researcher and a lot of other things, scientist on this whole COVID-19 experience and its transformations. Can you give us an overview of what you've seen, where we stand, and what we've learned?
Yeah, absolutely, Bill. And first, let me tell you, I'm going to be real happy to give up this job of being the COVID guy. That's one job I'm not going to miss. I'm really looking forward to getting back to just running a medical school, for lack of a better term. So yeah, here we are in the middle of really an Omicron surge, not only in Northeast Arkansas, Jonesboro, the state of Arkansas, and really the entire United States is in the middle of this. Here in Arkansas, you and I are talking here on January the 18th. We're averaging about 8,000 cases a day. That's a huge number of infections per day that we're tracking in Arkansas. Drilling down a little further here to Northeast Arkansas, in Craighead County specifically, we got about 665 cases was the high that we hit on the 12th of this month. So that's just, that just dwarfs any of our other numbers. If you remember way back in the original COVID, the high then was 150 cases or 115 cases a day. Then in August, we hit about 196. And now we're nowhere near that. We've just dwarfed it, 665 cases on the 12th of this month. Hospitalizations are up as well, unfortunately, and we always hate to see that. So here in the state of Arkansas, we're seeing an increase overall. About 1,400 people are hospitalized with COVID. What does that look like here for us in Northeast Arkansas? About 230 people on this day are hospitalized with COVID in our local area hospitals. So we hate to hear about any hospitalizations. One of the nice things about Omicron, it does seem to be somewhat milder, but I think we need to put milder in quotes. What does that mean? Well, it doesn't mean you're not sick at home. It doesn't mean you don't feel bad. It doesn't mean that you're not in bed with body aches and fever and that sort of thing. But there do seem to be fewer people that are hospitalized with it in terms of the percentage. And what I mean by that is compared to like the Delta variant or even the original strain, more people were hospitalized that got the virus. Here, pretty much everybody you know's got the virus, got the Omicron virus. Either you've had it or you've got it or you know somebody that's got it. It's spread very rapidly. Omicron is much more transmissible than the original strain and a lot more transmissible than even the Delta strain. It's about 5.5 times more transmissible than the Delta strain of COVID. So it's a rapidly spreading variant of COVID that really, like I said, we're seeing all over the place. It's impacting everybody from, those day-to-day work and school and everything else. People are out with it. And so hopefully we're going to be on the back end of this thing by February. We'll be on the back end of this thing and hopefully on the downward slope and be able to see some light of day.
And that I assume is dependent on no other variant after us or whatever. But when you mention the hospitals, it makes me wonder, are our hospitals under severe strain right now?
When we talk about hospitalizations and COVID, I think there's a couple things you need to remember. First of all, I can't say enough about our hospitals in this region in Northeast Arkansas. Obviously, our major centers here in Jonesboro and Craighead County. I mean, to say they've stepped up during this global crisis is an understatement. They've stepped up and stepped beyond, to be honest with you. I'm fortunate I get to meet with a lot of the hospital CEOs a couple times a month to kind of check the pulse, see how things are going. They're extremely resilient through all of this. And so I couldn't be prouder of our healthcare system here in Northeast Arkansas and the work that we've done to get the citizens of this area through this. But they're taxed. They're absolutely taxed. The nurses are tired, the doctors, the respiratory therapists, the lab techs, the people that deliver meals, the people that change the beds. Everybody is tired of this because it's been such a overwhelming strain on the system. And so it could be, and maybe we've got a few beds that are open in a hospital that you could put a patient with COVID, but you don't have any nursing staff, or you're short on doctors, or you're short on respiratory therapists. Right now we're seeing that pull nationwide. They're hiring nurses and specialists and pulling them over to California and Michigan and in the Northeast, paying them a lot more money. So that enticement, and I don't know that I can blame some of these professionals. For them, it's a way to pay off school debt and things like that. And it's an opportunity that doesn't come along very often, but it certainly does impact us here in our ability to take care of our citizens.
Yes, it does. And Doc, as you know, I recently recovered from a bout of COVID, and so recently, in fact, that I haven't had a haircut yet. So I think when we talked, but the fact that I had both vaccinations and a booster made the difference for, I think you used the word a man my age. That still sticks with me, but that's okay. So tell us about what you've seen as far as that goes.
Absolutely. And I'm glad you brought that up, Bill. Thank you for bringing that to the forefront. The individuals that do the best in terms of you don't get hospitalized, you don't get placed on the ventilator, you don't die from these viruses, are the individuals who have had their full vaccination series and have had a booster. So with the J&J, that's that single shot and a booster. With Moderna or Pfizer, that's your 2 shots plus another one or a booster. Those booster doses are doing a great job at preventing people from getting severely ill. We're seeing it time and time again. There's a great slide from hospitalizations down in Miami-Dade County in Florida, and they are tracking that down there. And some hospitals track this, and they put it out, and they show the individuals that are hospitalized in their hospital, those that have been fully vaccinated with a booster, those that have just been vaccinated, and those that have been unvaccinated. Tells the whole story right there in terms of how beneficial it is to not only be vaccinated, but to have a booster in terms of getting you through this. It's the difference between a runny nose and I don't feel good for a day or two to being intubated on a ventilator in the hospital for weeks.
That's pretty severe stuff. And you said February, we think we will get some relief. If all well, will we be back to any sort of normal? Is that predicted, or is this just going to be the new way of life?
So when we look at two questions there, let me go ahead and answer the first one in terms of what does it look like for us in the coming weeks and months. When we look at South Africa, which is where the Omicron variant started, they hit their peak about 30 days in, like almost exactly 30 days in. For us, that would be about now. We're about 30 days into this Omicron peak or Omicron wave, so to speak. So really sometime now, next couple of days, we should peak and start coming down. Now, where does it look like on the other side of it? Well, the South African group, they haven't really gotten back to their baseline yet. It's kind of been a little slower descent. And so it's not like it went up in 30 days and then came down in 30 days. It's taken a little longer than 30 days to come down. So we're still tracking that. But the good news is the peak happened in 30 days and things started getting better after that. So we're hopeful that about now or sometime this week, we will reach our peak and start going down. Now, that's all we've got to go off is looking at other countries that have dealt with this and trying to figure out, okay, how does that really impact us or what does that mean for us? Your second part of your question in terms of will we be behind this is, will we have any other variants that come up? That's really a roll of the dice. It really is. And we're not going to know that for some time. Now, we watch variants all the time, and there's dozens and dozens of variants all over the world that we're watching. Most of them don't amount to anything. Most of them, they may look bad, but they really don't do anything. Not many people get infected. They're in some other part of the world. They don't take off anywhere. When they take off, that's when it catches our attention. That's when, of course, we start talking about it. And that's exactly what happened with Omicron. It's the same thing that happened with Delta. We were watching it. We saw what was going on. It started to spread rapidly. It started to spread in populations that people that had already had COVID or that had been vaccinated at different levels. And so that's what catches our attention. So luckily, we see it in other countries before we see it here. So there's time to prepare for it. There's time to know that it's coming. There's time to look at the research and the data and say, look, what's the best thing we can do here to prepare for it? I think we are going to see COVID or the coronavirus move to what we call an endemic state. What does that mean? It means that it's probably not going away. It means it's probably going to stick around for a while. You're going to see it for the next several years or longer, and it's going to come in waves back and forth. Now, how severe are those waves? Hopefully they're not bad at all. Hopefully it's not any more than, a rough cold. Vaccination is going to be key. The new medications we've got that are coming out will be important. We've got 2 new medications, oral medications that are out. They're all in short supply now, no surprise, because we're in the middle of an Omicron wave, but that'll go. That'll go behind us, and that wave will be past us, and we'll be able to get these medications. We're hopeful to get them out really in mass supply by the first of the summer. And then we'll be ready for subsequent waves and things like that. Because the technology comes along, the vaccines will get better, medications will get better. And so that will help us through a lot of this in terms of getting back to normal. Questions now are, do we think there's going to be another variant that comes up in the summer or next fall? We don't know. And we don't know if that variant happens, if it's going to be weaker and less of an issue, more like a cold, or it's going to be stronger and cause us more issues. The thing that threw us off about the Omicron variant was, we expected, most people maybe that have had Delta or had COVID in the past, you're pretty well protected. Well, it didn't really work out for Omicron because it changed so much genetically that the body didn't really have antibodies available. So if you got sick with the original COVID strain, your antibodies didn't really help you as much. As a matter of fact, they're only about 19% effective in terms of protecting you against the Omicron variant. That's not good protection at all. That's why we make a big deal about getting the vaccine, because even if you get infected, that may not be enough to protect you from being hospitalized in the ICU or dying from a virus like this. So the vaccine is so important, and the booster is really what needs to happen. There's some new information out now. It's very, very early data, so I hesitate to even talk about it, but it's out there. They were out in Israel. They did a 4th dose. They were doing a 4th dose of the vaccine for individuals 60 and older. Right now, the data shows that doesn't really help much. So it seems like that the right place to be is the vaccine, the 2-dose vaccine of Moderna or Pfizer and a booster. That seems to be where it is right now. And that's not uncommon with other vaccine series we've had as well. As a matter of fact, if you look at the polio vaccine, for example, 3 doses is about where you hit the optimum for that too. So it's not like this is a new thing. Oh, you got to have 3 doses of this. We just get lazy because we're used to the flu vaccine being a one and done.
Doc, what advice do you have to anyone who is concerned about getting their children vaccinated?
I can understand that. As a parent myself, I would be lying to you if I said that we didn't have those conversations around our dinner table. I've got an 11-year-old, a 14-year-old, a 19-year-old, and a 22-year-old. And certainly, obviously, with each one of those, when it became time to, for eligibility for their age group for vaccination, we looked at the data and we talked about it. It was a conversation that we had, an open conversation. Luckily, that data is available. You can go to the FDA website, you can download the actual studies and look at it. When I looked at it and looked at the information, we talked through it, it was safe and it's effective and it's the right thing to do. So all of our kids are fully vaccinated. The only one that hasn't had the booster is the youngest because he's not eligible yet. His age group is not eligible for a booster. And to be honest with you, those younger individuals probably don't need one right now. We're still waiting to see the data, but right now their immune systems are so good that probably just vaccination on its own is enough to give them the immunity they need. But very supportive. I'm very supportive of the vaccination of young kids, certainly down to age 5. It's going to be a while before you see any vaccines younger than age 5. That's just a different group. It takes a while to get that data, and we got to make sure that it's right. And so I would not expect any data out in terms of those younger than 5, certainly until summer or late next fall.
Very good. I guess the last thing I'd want to ask you, Doc, is how has this affected your college, teaching your students? We hear that if you've got problems other than COVID, people, some are hesitant to go to the hospital. Are your students getting educated in things other than COVID?
That's one thing. If you were a fly on the wall in our medical school, that's something you would hear consistently is that, medical school doesn't stop during a pandemic. It can't. The way medical school works is we have to graduate groups of physicians that then go on into residency training to become internal medicine doctors, family doctors, pediatricians, surgeons, ER doctors. So we have to fill those open spots to be able to get that next generation of physicians, which are our state, our country, and certainly here in Craighead County and Jonesboro that we need. So we can't stop medical school for a pandemic. So what we do is we have to adjust medical school for a pandemic. So, and it looks a little different in our medical school than it probably does in other schools and in other businesses and offices. So all of our students are required to wear N95 masks when they're in the building, in labs, and working in groups. All of our lectures, for the most part, have been recorded, much like this. They've been uploaded. We have study sessions that our faculty will have with the students, much like this. So we do a lot of, we leverage a lot of technology to be able to make sure the interactions are still there. But medical school still is hands-on. We can't change that. So what we do is we protect them the best we can, our students, staff, and our faculty, in terms of when they are in person. And that's, they'll have on, goggles, masks. They had on, certainly early on, they had on the coats and things like that, but they're all wearing N95 masks because we know that that certainly does prevent transmission. So even if a student is sick or a faculty is sick, they're not spreading it to anyone else. And so we've been very successful with that strategy. We've done that from the beginning, and knock on wood, we've not had but maybe just a few infections at all that actually occurred within our building. The vast majority of students or faculty that were infected, it was from a household contact, which is the way it is for most people.
That's fabulous. And, I just want to close by saying we are so grateful for the work you do, the work your doctors and staff and students are doing. We're proud. The mayor talks about it all the time, how proud and at this time, how important it is that we have NYIT College of Osteopathic Medicine in Jonesboro. So thank you, Dr. Shane Speights, for joining us on Let's Talk.
Thank you, Bill. I appreciate the time as always.
Thank you.